the next thing we have, because we've covered a lot so far, we've covered asthma, pneumonia, cold and flu and strep throat and all the rest of that. Now we're moving on, and you should have a page in your packet that says sleep apnea. And so when it comes to sleep apnea, you can see that the wife is ready to smother her husband with a pillow, which is a whole nother subject of criminal activity. But she's sick of his snoring, okay? So we know that the patient with sleep apnea is going to snore super, super, super loudly. 99.99% of these patients are very obese. Their BMI is greater than 30. A large number of these patients have high blood pressure, diabetes, or some other disease, but just the obesity is enough. Because what happens is when they lay back, and the worst position for this patient is on their back, when they lay back flat, they're so obese that their tongue and all their soft tissues literally flat back and close their airway. And you know, we tease everybody with this one. This one is Uncle Leroy. Everybody has Uncle Leroy. You may not know you have an Uncle Leroy, but we all have an Uncle Leroy. And he lives in Detroit. He comes down to visit every now and then. He is retired from Ford. He drinks a lot of beer. He smokes a lot of cigarettes. He cooks out every weekend. He's retired. He has a lot of fun. He goes play bingo. He goes to the racetrack. I mean, he's a typical Uncle Leroy. The problem is you are having the family reunion at your house here in Cleveland. Uncle Leroy is coming to visit from Detroit. You are now a nurse, so you have this big ass 11-room house with 80,000 bedrooms, and you're so rich and all this other bullshit. So you tell Uncle Leroy, listen, I don't want you driving home because he gets drunk. I want you to go ahead and just stay over with plenty of space. I'm going to prepare the house for you. And so when the family reunion's done and nobody got shot and line dancing went off without a hitch and Big Mama got off the couch and all the stuff that we know happens at a family reunion, you get ready to prepare your house for all the people who are staying over from out of town. Now, go ahead, you get the pillows and the blankets, you send Uncle Leroy upstairs, and you get ready to clean up. Your daughters are helping you. That's what God made daughters for. The whole house is being cleaned. Everything's going back to normal, except for one little problem. You go upstairs to get ready for bed yourself because you're exhausted, and you feel pretty good because everything happened really nicely today with the family reunion. And as you go up the stairs, you hear this crazy sound. Sleeping something like this. So you know you're in trouble. Because I don't know if you paid attention to what I did just then, but you stopped, this guy stopped breathing. Like, I don't know if you heard that, like the whole, yeah, that's not breathing. That's horrible. And keep in mind, this is happening all night. So what do we know about this person who stops breathing? Well, number one, every time they stop breathing, they're not getting oxygen to their brain. Over time, which is what this is going to end up being, that's called Alzheimer's. So as they go through their night and they're not breathing, we have a patient who is killing their brain cells. And this patient is going to be in trouble later in life, right? We also know that any one of those times might be long enough to kill you. We know that entertainers have died from this. Big Pun, Barry White. Some of these guys you probably don't know because I'm old and I do know them. I know them very well, and you probably are like, who is that? But Levert, I mean, a lot of people have died from this. So, and they were all big, okay? So you know this is a big problem. Now, this patient needs CPAP. CPAP or BiPAP machine. If you look at the picture, you'll see this mask and this machine at the bedside, the bottom picture. They also need to be taught to do a few things and to not do a few other things. They should never lay on their back. They should choose to lay on their side one way or another. They should never drink before they go to bed. I told you about Uncle Leroy. When you drink, alcohol is a depressant. So it will automatically depress your airway, your respiratory rate. so that if you are in bed and you're already having 100 to 300 episodes of not breathing ever so many minutes apart, and then you throw alcohol on top of it, well, then you just encourage your body to say, lights out, I'm tired of living, goodbye, okay? They've got to lose weight. They could cure themselves if they just lost the weight. That's big. If the patient is not obese, you should be more concerned. So if this patient is not obese, but they snore very loudly, you should have them get evaluated for sinus surgery, because that's probably more likely the issue, and their weight played no role at all. And they will feel so good if they just get whatever sinus surgery they need. And the reason why is because it's so easy to do that, and they just need a CAT scan to look in their nose and figure out what in the world is causing this person to snore like this. We had a little girl, we were doing toe-to-toe one Saturday. We had a little girl, she was 8 years old. Her mom brought her because she didn't have a babysitter. She was snoring as she fell asleep. I said, oh my God, no, you've got to get her checked out. This is not normal. And the little girl needed surgery. She never snored again. So this is really important for you to make sure that this person who is not obese gets some type of evaluation, because it's kind of scary. Why are they snoring? This patient needs no sleeping pills ever. They're not allowed to take anything to make them sleep. They don't need to eat before they go to bed. They don't need any daytime naps. You'll know that it's sleep apnea because they wake up with a headache, they wake up with a dry mouth, they have not felt like they got any rest at all, so they're still exhausted. Not to mention you got loud snoring going on here. Some patients will need surgery even with the overweight, but most of the time they just need a CPAP machine. Remember, with the CPAP, it's positive airway pressure, and it's continuous. It has to fit very tight to avoid any leaks. If there is a leak, the pulse ox will go down. So I just had this happen in the hospital. I kept getting a call from what we call the CMU unit, which is continuous monitoring unit. And they monitor anybody that's on a monitor. So if I have a patient on telemetry, they're going to see what's going on. If I have a patient on continuous pulse ox, they're going to see what's going on. They keep calling, telling me the patient's pulse ox is 88, it's 86, it's 84, it's 83, it's 89, it's 80, whatever, which is not allowed. I go in the room. Your first nursing action for a patient with obstructive sleep apnea with CPAP on and the pulse ox is dropping, check the fit of the mask. Just check the fit of the mask, because that's probably what's wrong. Our bigger problem is that the patient with sleep apnea doesn't want to wear the freaking mask. They've been told that they need it. They've gone through a sleep study, which is basically an EEG of the head. They've gone through all this. They've been diagnosed with obstructive sleep apnea. They've been told that they need a CPAP or BiPAP machine to save their life, and they refuse to wear it. Now, that's the height of stupidity. Most of these patients do smoke. Almost every single one of them is over 40 years old. And so there's a very real risk that they could die from this. So yeah, this apnea is no joke. These periods of not breathing is no joke. So you want to remember that. Now, some patients are ordered a BiPAP machine. Just remember, if you have this on a test, a BiPAP is where the pressure is higher during inspiration than expiration. So that it mimics your regular breathing. The BiPAP machine is going to be higher during inspiration than expiration. Now, you have this extensive information on sleep apnea. You've got some pictures of the different types of CPAP machines that the patients will have. You've got the alveolar issue. If you keep on going, I want you to get to the page where you see COPD, and when I come back, we're going to get started right there.